it's Dr. Bard. I'm here with Mount Lookout Chiropractic. We are continuing our series on upper cross syndrome. Today we are going to be working on getting the joints moving that aren't moving enough. There's some sort of adjusting, and we'll go through that in just a little bit, but we're also going to be working on some of the muscle tightness that can surround the upper back, the neck, the shoulders to really just help decrease pain. So come along, we're going to get started. Okay, so first thing we're going to work on is getting some extension through what we call our thoracic spine. Our thoracic spine is the middle of our back here. A lot of times when we have upper cross syndrome, we fall into this posture. So we get a lot of flexion and a lot of tension and stiffness and soreness through here. So first thing we're going to do is make sure that this spine is moving the best that it possibly can. So she's going to go ahead and lay on back for her adjustment here. We're really going to focus it on the areas where she's having most of this stiffness. Good. Okay, so the next thing we're going to work on is what we call our SC joints. So these live in the front side of the chest here. We also are going to work on tight pecs. So we tend to get this forward rounded shoulder posture when we have upper cross syndrome from that sitting at the desk, looking at our computer, even reading a book for long periods of time. So we're going to work on opening this space up here. So there's a lot of different ways we can do that. Today we're going to be using the drop tables. So our cool little table here lifts up. We're going to work on getting some great motion through that front side of the chest. She's also going to reach this hand back. She's going to feel a good stretch in the front side of the chest. Really focus on lengthening pec muscles. Good. We're also going to talk about tension in the back side of the neck. So when we get this forward rounded shoulder, we compensate by tilting our chin up, which can cause shortening in our suboccipitals, which are these muscles that are underneath the skull and they attach to the neck. So we're going to work on just lengthening and stretching those. We just do a manual traction, so just working on some of this tension, really relieving that tightness. And then after this, we can move into some sort of adjusting based on the patient's need as well. We also are going to work on the CT junction. So CT junction is where our neck meets our upper back. This area here tends to get really tight as we sit in this forward rounded posture. It's also a really common area for some degenerative changes. So we need to make sure that this space is moving well too. So we have a few different options. We can mobilize the joint, which is not the actual thrust of the adjustment, or we can actually adjust through it depending on what the patient needs. So we're checking here for how well her CT junction moves. She's a little tension on this right side, so for Gianna, I'm just gonna mobilize through it. She's young, she's flexible, she's healthy, so we're just making sure that that joint's moving well.